And welcome to our Monash Partners CCI lunchtime seminar. We'll just hold off a couple more minutes while people join, and we won't be long getting started. Welcome and thanks for joining us today. Okay, good afternoon. I'm Angela Jones from the Monash Partners team, and it's my great pleasure to welcome you all to our first Consumer and Community Involvement Lunchtime Seminar for 2022. We're excited to be offering you a series of seminars again throughout the year. The title of our presentation today is Developing a Consumer and Community Involvement Strategy for a National Women's Health Research and Translation Network, and we're delighted to have Leslie Arnott and Rebecca Madill joining us as presenters. For some of you who may be joining a Monash Partners event for the very first time, Monash Partners is a partnership, a collaborative partnership of 12 leading healthcare research and teaching organisations. We're accredited by the NHMRC and as an advanced health research translation centre. Our partners are listed at the bottom of the slide, and our purpose is to connect researchers, clinicians and the community around innovating for better health. I'd like to take a moment to acknowledge the traditional custodians of the land on which we're meeting today, and in a spirit of reconciliation, I pay my respects to elders past, present and emerging. I also extend those respects to any Aboriginal and Torres Strait Islander people joining us for this webinar. Just a little bit of an overview of the session today. The purpose of this session is to provide our community with practical insights around the principles and practices of consumer and community involvement and some of the resources and frameworks available to support it. The idea is that we can learn from each other, ask questions and discuss topics that are of mutual interest. Just to let you know, today's seminar is being audio and video recorded, and we will also save the chat. We'll be monitoring the chat throughout the session and popping resources and worthwhile information in there. So please keep an eye on that. We will also circulate a summary of the key points after the session. This acknowledgement will follow with a presentation, and then obviously we'll have some discussions and questions for everybody. Just to highlight some of the resources available to support you in consumer and community involvement, Monash Partners has developed a series of free online self-directed modules on the Monash Partners website. Of particular use to people are the remuneration guidelines and some of the tip sheets around using technology. We also provide advice and support and can be contacted at that email address for those of you working within our partner organisations. Our colleagues at the Western Australian Health Translation Network have also developed a consumer and community involvement handbook, and the link to that is there. And they also offer an introductory 30-minute online training module that's available to all at no charge, and the link to that is also there as well. Just to let you know, these are our social media handles and our website address. It's now my great pleasure to hand over to Professor Helena Teed. Helena is the Executive Director of Monash Partners and also the lead of the Women's Health Research Translation and Impact Network under the Australian Health Research Alliance. And Helena is just going to make some introductory welcome comments today. Over to you, Helena.
Thanks, Angela. So it's great to see so many of you joining us today. So just for context, the Academic Health Science Centres, which Angela has described, our purpose is to connect researchers, community and healthcare providers to innovate for better health. And within that, that involves capacity building for our workforce. And clearly there's a need to do that, especially for those who identify as women. And indeed, aligned with that government priority and also our priority, we have worked very closely with federal government. And that was in the context of the fact that 5 years ago, when the original centres were accredited, there are now 10 of us. We were originally 4. Those 10 centres from all across the country came together and formed the Australian Health Research Alliance. Basically, we do work together in activity that's national in reach and collaborative and seeks to build capacity in the workforce, connect and embed research into healthcare and improve health outcomes for the community. In that context, those 10 centres responded to a call by the government to address issues around women's career development, women's capacity building, the fact that there was no women's research network in the country. Unlike there was a perinatal AHRA, Australian Clinical Trials Alliance initiative, but there was no national women's health research and translation network. And in response to that call and aligned to the National Women's Health Strategy and the research program around it, we formed a National Women's Health Research, Translation and Impact Network. That was formed several years ago, and then we received a $5 million grant to support that over 5 years. There's an extremely strong and genuine focus in that network on women's voices and on partnership and guidance with women as community members in the development, building capacity in consumers and also researchers who need to work with consumers, but also about building capacity in careers and building capacity in partnership and research. So you'll hear from Leslie, who's one of our spectacular consumer leaders, shortly, but this is in the context of that $5 million national program to engage and support consumers for genuine collaboration in research, and also to build the careers and capacity of women in women's health research and translation. And it's my privilege to have been able to spearhead that initiative, which is now chaired at the moment by Professor Deb Loxton at the New South Wales Centre, and will come back to being chaired by Professor Jackie Boyle at Monash next year, but it is genuinely a national collaboration. And so I'm going to hand over to Leslie, but I think some of the groundbreaking work that this group are doing is pushing the boundaries well outside people's comfort zone, not just in terms of consumer and community involvement, which they'll tell you about, but actually also we've completely flipped the paradigm around how research is done. None of our grants are competitive. They are actually co-produced, which means we have consumer leads working alongside academic leads. There will be a topic of interest and everyone will have to come together, and that includes the best people in the country from each of the centres, and work together to solve that problem with and for the women of Australia in terms of improving their health. And that is a completely different paradigm to the academic application and solution model that we currently have. So we hope to learn a lot on the journey, and Leslie is in that wonderful uncomfortable zone of being uncomfortable with being uncomfortable as we go on that journey. So she's going to tell you about that, and I'm holding on to her coattails, learning as we go. So over to you.
Thanks, Helena. I'll just take a moment to introduce Leslie and Rebecca to everybody that's online. Leslie Arnott has over 19 years' experience as a consumer advisor and advocate in maternity services. She's a co-founder of Lamar's Australia and heads up a birth equity advocacy research program. She's also chair of the Consumer and Community Involvement Sub-Committee for the Women's Health Research Translation Network and the Consumer Partnerships Lead. Leslie is joined today by Rebecca Madill, and Rebecca is the Consumer and Community Involvement Project Manager for the National Women's Health Research Translation Network. She has a background as a registered nurse and is very passionate about public health. And we welcome them both today and thank them so much for their time. Over to you.
Thanks so much, Angela. I loved Helena's description about going to the uncomfortable, being uncomfortable with the uncomfortable. That's just a delightful phrase. Today, I too would also like to do an acknowledgement of country, and we'll start our presentation today by acknowledging the traditional owners of the land upon which we work, live and play. And we too pay our respects to elders past, present and emerging, and to all those who have cared for this land for generations. We also acknowledge that sovereignty was never ceded, and this dispossession remains largely uncompensated and unreconciled. And with our acknowledgement comes a commitment to using our work and our platforms to help end this injustice. We were going to do introductions, but I have to say Angela did a terrific job in introducing us. I just want to say that originally I come from the land of the Mississaugas, which is a tribe that occupied what is now commonly known as Toronto, Canada. However, I've lived most of my life here in Australia on the land of the Wurundjeri people of the Kulin Nation here in Melbourne. I'm the Consumer Partnerships Lead, as Angela mentioned, for the Women's Health Research Network, Impact Network, and that's affectionately known as WHRTN. So if you hear us refer to WHRTN through this webinar, you'll know what we're referring to. And of course, I also chair the Consumer and Community Involvement Subcommittee, which is affectionately known as the CCI Sub-Committee. Beck.
Thanks, Leslie. So as Angela did a fantastic introduction. So my name is Rebecca Madill. I'm coming to you today from the lands of the Wurundjeri people. And as mentioned, I am the project manager for our CCI Sub-Committee. Whilst I was born in Australia, both my parents are from Mauritius. So I've got our little Mauritian flag down in the corner there. So Helena's done an excellent job of introducing our network. So we are from the Women's Health Research Translation and Impact Network, and these are our research translation centres, which form part of the network down the bottom. Sorry, I'm having trouble with my slides here. So just a quick overview with the governance. So the AHRA Council sits at the top, and then underneath that we have the WHRTN Steering Committee. We have our National Program Manager, and then underneath that we have our 4 subcommittees. So the one circled in red here is the one that Leslie and I work with, which is the Consumer and Community Involvement Subcommittee. We also have a Workforce Development Subcommittee, an Indigenous Subcommittee, and the Research Subcommittee. So I'm just going to quickly talk you through the vision for WHRTN. So it's to empower and improve equity, health and quality of life for all Australian women, to integrate prevention, healthcare, research and translation for community benefit, and to advance and support the careers of women in research. We have 9 priority areas. So the first one is preconception, pregnancy, postpartum and interpartum health for women and babies. There's mental health, there's reproductive health, chronic disease and preventative health, healthy lifestyle, nutrition and physical activity, violence and abuse, Indigenous health, healthy ageing, and our last one is sexual health. Just a slide on our principles. WHRTN considers women in their lived environment and social determinants of health. WHRTN accepts responsibility for co-design, translation, impact and community engagement. WHRTN incorporates primary, secondary and tertiary prevention. And WHRTN promotes health literacy and equity for priority and vulnerable populations. I'm now going to hand over to Leslie, who's going to tell you a little bit more about our CCI subcommittee. Leslie?
Thanks, Beck.
Yeah.
I just wanted to make sure I was off mute then. To embed CCI in its operations and activities. So what does embedding CCI in all what we do really mean? Well, for starters, there's been funding allocated to 2 roles in CCI at WHRTN. Beck's role as the project manager of the CCI subcommittee, and me as the consumer partnerships lead. So it's my responsibility, together with Beck's help, to seek and find a broad range of experienced consumer advisors for our committees. And this means linking in and building relationships with consumer-led groups and peak health organisations who can help us and recommend appropriate representatives for that space. On the steering committee and on 3 out of the 4 subcommittees, we have places for 3 consumer advisors. And this is really important. 1 consumer advisor on a committee is vulnerable and perhaps tokenistic at times. 2 consumer advisors are supportive of one another, and 3 consumer advisors is empowering to not only themselves, but also to the people for the rest of the committee as well. And with the CCI subcommittee, we'll soon have equal amount of consumer advisors to that of researchers and clinicians. And that includes a consumer advisor in the chair position. So we really are we're doing equal partnership between consumers and researchers and clinicians. It provides genuine sharing of leadership and it develops a mutual trust in that all members are truly valued. This is a new way of leadership in research. It's a leadership that is fluid and it's sometimes acquiescent, if I can use that term. It moves from clinician to consumer from consumer to researcher, researcher to consumer, and so on. And this type of leadership reminds me of a paper that I read for my master's degree a few years ago. And it was at a university in the US. And I was actually chuffed to discover that the authors of the paper were Australian, and indeed Indigenous Australians, one of whom lectures at Melbourne Uni here. And when all of the students at the end of the course were asked, what was your favorite piece of literature or paper? Everybody, hands down, chose this paper, and it's absolutely beautiful. Anyway, the paper is entitled Traditional Midwifery, or Wise Women Models of Leadership, Learning from Indigenous Cultures. And it begins with a stunning quote, and it is in reference to maternity care and looking after women in birth, but I do have to say it is so applicable to a broader context. So it starts with a stunning quote from Lao Tzu, who is a philosopher of the 5th century BC. And he said, quote, "Lead so the mother is helped, yet still free and in charge." And I can't think of a more perfect quote to describe fluid leadership. And fluid leadership is what we're developing with consumers and researchers in WHRTN, working together in everything that we do. Next slide back. So why do we involve, engage, participate with consumers? Well, Australian health services are required to demonstrate commitment to the healthcare standards that was set down by the Australian Commission for Safety and Quality for Healthcare. And particularly with standard number 2, which is known as partnering with consumers. So I'll just read you an excerpt from that standard. And it says, leaders of a health service organization implement systems to support partnering with patients, carers, and other consumers to improve the safety and quality of care. Patients, carers, consumers, clinicians, and other members of the workforce use the systems for partnering with consumers. The intention of the standard is to create a health service that is responsive to patient care and consumer input and needs. Now, but when the Australian Commission of Safety and Quality first released these healthcare standards back in 2012, they came as a real shock to everybody, I think, especially standard number 2. So in a world where we traditionally acknowledge clinicians as major decision makers, not only in research, but in healthcare, they were all of a sudden expected to partner with consumers in service planning, partner with consumers in designing care, partner with consumers in service measurement and evaluation, and partner with researchers to prioritize research topics. So for most clinicians and researchers and clinical leaders, this was completely foreign to them. Like, no wonder services and health organizations needed years to get their head around this and to hopefully demonstrate it successfully. Like, it took everyone a long time to work out what engaging with partnering with consumers in healthcare actually really means. Well, I reckon WHRTN is quickly becoming a flagship in this space, in that Helena Teed and others applying for the grant to create and develop the network sought funding specifically for CCI, for consumer and community involvement. And not only just to tokenistically request that funding, but more so that it was going to be used so that CCI was embedded in the network right from the word go. And on that last point on our slide, different tiers of consumers in partnership in healthcare. One of the things that I've discovered throughout the years as a consumer advisor, and indeed through the work that Beck and I have done together, is that just like researchers and clinicians who are at different stages of their professional and personal development, so too are consumer advocates and advisors. So we need to actually be able to utilize their skills at different times of their life with different expertise in the right way, in the appropriate way. And this is really important because we've got different committees, different working groups, different focus groups, workshops, and so on, and they'll all require different consumers of varied experiences, as well as different combinations of consumers. That can be powerful as well. So, for example, on our Wharton Steering and Subcommittee, we've been looking for experienced and diverse consumer advisors, perhaps those who have worked on committees before, who have worked with researchers, who might understand policy, who will understand how the health system works, for instance, whereas someone sitting on like a CAC, which is a consumer advisory committee in a hospital, or a focus group or a workshop, the lived experience is enormously powerful. And I have to say, I love the fact that our committees have 3 consumer advisors on each one and then 6 on the CCI one, because you can then mix that really beautiful expertise, longevity as a consumer advisor, for instance, with somebody with the lived experience. So those 2 things, whether you have it in 2 people, whether somebody's system savvy and has the lived experience, or indeed has both, that combination is enormously powerful. And by allowing to have 2 or 3 positions for consumer advisors on committees, actually realizes that. And that is fantastic. That is an ideal. So involving, participating, and engaging with consumers. Now, what does all of that mean? I got to say, you can just turn to Monash Partners for that one. They're all over it. It's on their website. It was mentioned earlier. Angela was talking about the training modules. You'll see the beautiful, articulate Magdalena Scribant from the UK actually articulating the differences between these 3, but I can do that here today. So involvement means working in partnership with consumer advisors and or the members of your local community, and they're part of your team when it comes to things like working on committees or co-design or co-production or working on a research project. So it's the involvement is the I in the CCI. Participation is where you have patients or members of the public as research participants. So you're collecting data on them. And if that's the case, then of course you need ethic approval for that. And engagement is where you share your research fundings with the general public. It's a one-way activity with no expectations of receiving anything back from your audience. So I guess we've got to get our terminologies right in this space, and maybe we should be saying things like, how are we involving consumers in this project, rather than have we thought about consumer engagement for this project? So it's completely different when you understand those terminologies. And Beck, I was just thinking about this earlier on, that maybe we should change the name of our strategy from consumer engagement strategy to consumer involvement and engagement strategy. It's a working document, so maybe we can change the title.
Absolutely.
So the IAP2 spectrum of public participation is quite useful. I don't expect you to read this whole slide, but it's kind of nice. It takes you through some steps in the ways in which we can interact with communities that we serve. So it covers a spectrum of informing the general public to empowerment, where the final decision is placed in the hands of the public. And I can't help but think, I got to say, of an assignment that I did work at some years back, and we were looking at the Lakota tribe in the US, an indigenous tribe in the US, and the local university wanted to do some research. So they conducted CBPR, which is community-based participatory research. And what it did was exactly what Wharton is attempting to do now, and what we are doing now, which is actually involving consumers right at the very beginning. So they went to the tribe and didn't say, this is what we'd like to research, can we work with you? What they said is, what would you like us to research? We need your help. And so they partnered with the tribe right from the very beginning. And one of the things that I will highlight here is that CBPR takes a lot longer because, of course, that interaction with the general public requires time. But what ended up happening was they discovered what they really should be researching, what the tribe really wanted to know, and also and then they partnered with them through the research. So they had elders and or other tribe members involved in the research process as well. And in the end, what ended up happening was that the IP, the intellectual property, was owned not only by the tribe, but also by the university as well. So it was co-owned by both. And I thought that's a brilliant example of that idea. Beck, I'll hand it over to you.
Thanks, Leslie. Thanks for that stunning introduction and background about our subcommittee and some of the work that we're doing. So we were asked specifically today to talk about a strategy that we developed. So we have developed a strategy for the grant over the next 3 years. So to do that strategy, one of the steps was to hold a consumer workshop and get their input. So I'm just going to talk you through the steps of how we did that. So earlier I presented our 9 priority areas. So for the first thing we did for each of our priority areas, we identified potential consumer-led organisations who could potentially be invited to be involved in our workshop. So as an example, for this priority area, which is preconception, pregnancy, postpartum and interpartum health of women and babies, we identified 5 possible consumer-led organisations, and whilst there may be many more, these were the ones that were identified at the time. So there was Lamaze Australia, Australian Breastfeeding Association, Access Australia, Multiple Birth Association, and SANS. So we did this for all of our 9 priority areas. So we came up with a possible 40 consumer-led organisations to invite. After that, we asked members from our subcommittee to vote on their top 2 organisations for each priority area. That left us with 18 potential consumer organisations to invite. And then of those 18 consumer organisations, we asked them to identify 2 consumer representatives from each of those organisations. So the first step was to obviously connect with these organisations. We did not have specific contacts, so it was a matter of looking up website information, using those forms or using the generic email address to make contact initially. People were really engaged and really willing to give their time, which was wonderful. This was followed up by a phone call, and often speaking to people and telling them a little bit more about the network and what we were hoping to achieve through our consumer engagement for the strategy was really great to talk to the people on the ground and see what they thought and who could be appropriate for that. So when we were engaging with people from certain consumer-led organisations, they had different ways in how they would engage with their consumers. Some people wanted to put out a little paragraph in their newsletter. Some other organisations tapped a couple of consumers on the shoulder who they thought might be appropriate. And therefore the comms for our consumers were tailored to each organisation as required. So once our consumers were identified, they were invited. And in this step, we made sure that we asked our consumers if they required any assistance during our workshop. And this was really valuable for us because it did highlight some consumers with learning needs, and we did have some pre-reading. So for some of that pre-reading, some of it can be, there can be quite a few pages. So it did mean that we were able to meet with some of our consumers prior to the workshop and go through that material and make sure they felt comfortable with it and if they had any questions. One consumer in particular gave some excellent feedback post-workshop for her learning needs, and that was about the number of people in a breakout room, and she recommends having 4 people maximum in a breakout room, which is certainly something that we've taken forward with future consumer workshops. Then the next step that we did was we organised people. So this involved organising our consumers and members of our subcommittee. So For each of our breakout rooms that we plan to do in the workshop, we had a consumer lead that breakout room. So we had a meeting with our consumers a couple of days before and provided them with some information about facilitating small group discussions. Certainly, answered any of their questions and provided them with any support that they needed. And then we asked the academic members from our subcommittee to take notes and share them back to the subcommittee in the final report writing stage. So one of the reasons why we invited our consumers, it was Leslie's point before about shared leadership and, empowering our consumers as much as possible. Then obviously we did the workshop. So it was a 2-hour workshop. We had a brief introduction and then we had some time for some breakout rooms. Prior to the workshop, we did ask our subcommittee to develop some key themes for the workshop. So these were the key themes we asked our consumers and our academic representatives and our researchers to discuss during the workshop. So I should add that while we had potential 36 consumers invited to the workshop, altogether we had 30 people attend, and that was a mix of academic, researchers and consumer representatives. So the 4 themes that we really focused on for our workshop was looking at the creation of a National Women's Health CCI Alliance, engaging with underserved, marginalised, vulnerable and silenced populations, consumer ambassadors, and staying connected. For each of these themes, we asked our breakout rooms to discuss 2 of them. If they had time, they could discuss more, but we focused on 2 for each of our for each breakout room. And then an important step, obviously, is reporting back. So we asked people to report back via this function here. Some people may be very familiar with it. It's the whiteboard function in Zoom. This is a great function. It allowed people to be able to write up their feedback. We always invite people, if you're not familiar with this, people can obviously talk what their responses were, and one of the committee is able to type them up, or they're able to use the chat function to tell us the outcomes that were discussed in their breakout rooms. Whilst we didn't use this tool here, this is called Mural. This is another tool that can be used in workshops, and this is online workshops, and this is a great tool. You're able to categorise themes and able to categorise comments with emerging themes and use sticky notes in various colours. So the next step was to write our strategy. So from the amazing input we had from our workshop, we developed 6 main activities for our subcommittee, and they are looking at Wharton Committee consumer representation, and that was Leslie talking about making sure we have consumer representatives at all levels of our network. A major theme is working on consumer capability building, engaging with our consumer champions, engaging with underserved populations, the development of a National Women's CCI Alliance, and looking at CCI co-production research, for which there is a huge body of work that's happening right now, and it's very exciting. So the next step was obviously a conclusion and reflection, and one of the most important points here is to make sure that we remunerated our consumers post-workshop, which we did. Unfortunately, for our first workshop, it took a little bit of time to get those processes up and running, but once now that they're in place, it's very much more a streamlined process. So we remunerate our consumers via a gift pay express card, which they can use in 80 different shops, or if they have an ABN, then they can be remunerated via an invoice. The strategy was then sent out to our to our subcommittee for edits, and then it was endorsed. And once the strategy was finalised, then it was sent to everyone who was involved in our workshop, and to say thank you for your input, and this was the concluding document. So highlights from our strategy is that it is a guiding document and it provides a resource for us to go back to use that information in guiding our 6 main activity areas that was spoken about before. We have high-level timelines, and we try and make sure that we meet them as much as possible. The strategy was developed through a consultative process with our consumers, women researchers, and our academics. The goal for our strategy is to make a real difference for consumers in women's health and medical research. And the strategy does set out a bold vision that embeds CCI in Australian women's health research and translation. And Leslie and I work really closely, and we really do have this ethos and really have this belief in making sure that the rest of the network has CCI at the front of its vision at all times. And it's something that we certainly hope to champion going forward. I'm going to hand over to Leslie now, who's going to talk about some key learnings. So there was certainly, that's how the workshop was run, and it wasn't perfect, and we've learned a lot.
Thanks, Beck. Well, I'm always banging on about this one, I have to say, which is time. And I alluded to it when I was talking about the story about the Lakota tribe in the US, but CBPR takes a long time. And it's sometimes things that we forget to allot in order to make the discoveries that we need to discover. But if we can allow that time and build that trust up with consumers, the discoveries can be research changing, and they can also be service changing. So in the lead up to our workshop, we probably could have given our consumers more time so that we could have brought a lot more consumers on in the journey. So perhaps extend the time. Even in the workshop, we actually had a 2-hour workshop, and I've actually heard this term now having worked with researchers for a few years and also clinicians, that people have an idea of a workshop being 2 hours. And when you're talking about consumers, you actually need a workshop that's at least half a day, if not a whole day, or even 2 half days, whereby there's a break in between so that they can get their head around what has been discussed. They can also think of new ideas to bring to the second workshop as well. And we have had this idea, like when the commission came out and said, okay, you've all got to work with consumers now, and you've all got to partner with consumers and all that type of thing. What we forgot to do sometimes is we said, you know, this is how we do it. This is how we conduct it. These are the timeframes we usually run by. And now we're going to put consumers on top of that. And we've got to stop doing that. We actually have to go, if we're putting consumers involved in this process, then we need to extend the time. And we also have to request that if there are discoveries made along the way through the consumer partnership, that we need to request and can justify additional time required to conduct what we're conducting. That's really, really important. We can't keep going in the same parameters that we're in when we've got so many more people and so much more lived experience to consider when we're embarking on various different projects. The other point there too on that slide is different strategies for connecting with consumers. This is something that I discovered in my master's degree and I absolutely loved, is that we are constantly calling out for diversity, and we're constantly calling out for different ethnicities and people involved with different experiences and all that type of thing. To some populations, coming and sitting on a committee at a certain time in a building and at a certain place, it's not the way they meet. And if we want that beautiful diversity that is across our land, then we have to start learning about how to meet differently. And it reminds me of a physiotherapist that I had interviewed for my master's degree, and he was from the Northern Territory, worked in the Northern Territory, and he was talking about the Indigenous people that he worked with. And he said, you know, Leslie, the Indigenous people that I work with here find sitting across a table confronting. They don't sit across from each other. They like to sit with each other, but not across from each other. So that's quite almost alarming for them. And he said to me, the best way I've thought of how to meet with them is exactly how they meet, which is they sit shoulder to shoulder, they sit on the ground, and you both sit facing the sunset or the horizon. And he said, you've already got a shared vision already, because you're both looking the same way. And he said, and all you do is you just sit and you wait in silence, and then magic happens. And I'll never forget that quote, because we have to consider that different populations meet in different ways. So we've got to go into our communities and meet them in those different ways. Meet over food, meet over fires, sit on the ground, all that type of thing. So further to our key learnings with time, we have deadlines. That's what I was talking about before. So we didn't have a lot of time after we had actually put the engagement strategy together, or should I say involvement strategy, because we did have a deadline. So we probably pushed them a little bit to consider what had been written, just to add, final comments. And the other thing too is, because we didn't have a lot of time, we would have liked to have sent it out to a broader audience. So even if those people couldn't have been involved in the formation of that strategy in our workshop, they could still be able to be involved if we had sent it out to a broader audience. So that's just a key learning that, and look, don't get me wrong, we're never going to be able to reach everybody all the time, but we've got to be careful about creating so many time constraints that we actually don't get that broad representation that we so desperately seek. I love this slide. Thank you, Beck, for making this so visually appealing. It's a really good point. Check which hats consumers are wearing. When you're asking for consumer representatives or advisors to be on committees and or to be involved in workshops, there will be different types of consumer advisors and advocates. And I agree that all of us are consumers of our healthcare system. But when we're talking about forming committees and having researchers and clinicians on committees, it's really important to keep that consumer voice really independent. And so when you're asking for consumers to join you, it's probably a good idea to make a point to say, preferably with no research or clinical background, because then it keeps that voice pure. Because I actually think about the types of committees that we all sit on. You might have, 12 to 15 clinicians and researchers. If you've only got 3 spots for consumers, you don't need another consumer sitting there who also has a foot in another clinical or research camp. So it's really important to keep that consumer voice independent, because their view of the services and or research are completely different to those of clinicians or researchers. The other thing too is that we did prioritize, I think Beck mentioned that earlier, about using consumer or contacting consumers from consumer-led organizations, not just from specific women's health organizations, even though they are connected into some consumer networks. Consumer-led organizations are completely free of that researcher and clinical influence. And so we prioritized that first. We went and made to see if we could get representation from them first. And as I said earlier, the lived experience plus your systems experience is absolutely ideal. And that's why I absolutely love that on our committees, and I'm encouraging our centers in our networks to do the same, which is have at least 3 positions for consumer representatives, because it allows for the room of having the lived experience as well as somebody who has that high level policy understanding and a really good solid knowledge of our healthcare system. And finally, our future directions. Well, in my capacity as the consumer partnerships lead, I'm going to be continuing to provide support and mentoring and training, if required, for our consumer advisors. And that's also so that they feel that they are safe and supported and empowered to do the work, so that they can leverage those voices that they represent at our tables. We'll strengthen connections with the community by seeking out consumer champions from diverse communities who may help us bring even more voices to the table. And we'll develop our partnerships with consumer-led organisations and explore what Beck was talking about, which was the opportunity of developing a consumer alliance with organisations such as the Australian Women's Health Network. It's really, I find that idea quite exciting. Can you imagine you've got in every centre a minimal of 3 consumer representatives on every committee through every service that makes up the centres, and then you form that alliance and you are in constant connection with that alliance. The strength of the voices there and the diversity of the voices is just fantastically second to none, and I'm really excited to actually be able to develop that. We'll also support our centres to develop strategies on how to partner with their own consumer networks in the communities that they serve. So consumer involvement goes beyond the work of our committees, and we seek to embed it across our entire network.
Thanks, Leslie. So just as a wrap up, you can connect with us on LinkedIn and Twitter, and we're very, very soon going to launch our website and have a newsletter. So please connect with us on social media, or you're welcome to send Leslie and I an email if you'd like to learn about anything else that we've discussed today. Thank you very much for your time.
Thanks so much.
Thanks, Beck and Leslie, for a terrific presentation and sharing with us your experience over the last year and a half as you've developed this strategy and progressed this really amazing body of work. What we wanted to do now was just open up to some questions and have a little bit of discussion. So just to everybody's online, if you've got questions, please feel free to pop them into the chat. One question that's come through on the Q&A is, do you have other mechanisms to engage with women who are not engaged in formal structures or groups? How do you work with call communities and women in rural and remote communities? Beck, anything you'd like to add there?
Are you all right with me to answer that, Beck?
Go for it, Leslie.
Yeah. Yeah, it's always going to be a challenge to reach those people, absolutely. And that's where a role like your consumer partnerships lead can be instrumental in going into communities and finding them rather than going the other way. We have to take the committee into the community. I can remember doing a project with the Health Issue Centre when I was with them, and they were doing a piece about reaching older Australians in regional areas. And what they did was, because a lot of people might not be on the internet and they might not be connected to those groups that we were just talking about earlier. And so what we did is we hung out at the chemist, we hung out at pharmacies, and we asked if we could, ask people different questions. And sometimes they were carers of older people, because as older people, as we get older, sometimes, we need more support with pharmaceutical goods and that type of thing. And we found we actually were able to connect with people in the community who weren't on the internet and weren't locked into any of those consumer-led organizations which we spoke about. And we were able to talk to them as well as their carers. So it's the idea of going into the community and seeking them out. It's not the other way around anymore. Does that kind of help with that question?
Leslie, could I add that there's also the regional centres? So just because people may not be aware, there's New South Wales Regional Centre with people and consumers in that region. There's the Tropical Australian Centre, which goes right across the north, up into Northern Territory. And where's the other one? There's the third one. Remind me.
Central Australia.
Thank you.
Central Australia, yeah.
Which is completely Indigenous community led. So those centres are absolutely immersed and partnering with their consumers. So the regional rural is not our biggest challenge. Indigenous is not as big a challenge that could be. Cold groups are, but having said that, Monash Partners and Sydney Health Partners are smack bang in the middle of the highest density of cultural, linguistic, diverse and refugee groups. So we do have strategies to do that, and we have a lot of links through the interfaith communities. The interfaith communities can be really powerful, and also through the local government agencies and local councils. So that's some of the ways that we do this, and go out to reach out through those organisations. But the days of calling for volunteers for elite capture and consumer and community involvement only are numbered. And genuine representation is really important. We had a consumer group we hosted for the Department of Health the other day, and I think we had 5 diverse representatives from diverse backgrounds and 2 Caucasian representatives on that particular initiative. So we do make a really concerted effort, and we do have strategies to deal with that.
And you're absolutely right, Helena. And also, as Beck and I build the bank of consumer representatives on our committees, we're just about to bring another representative on who is Middle Eastern, and she's highly connected. And that's why we're looking for people like that who are highly connected into her community. But you know, one of the points that she did make when I spoke to her initially was, and here's that time thing again, she said, you know, this will be great working with you. And she said, but it's going to take time to build the trust in that community for Wharton to link into that community. And I said, absolutely, I completely appreciate that. So even through our consumer representatives, they can find our consumer champions within the community, so we can link into those communities as well.
Just a couple of questions that have come through that I might just put to you. One question is, there was have you got any planned work around outcome measure development? And if so, what does that look like? Noting that you had some comments relating to outcomes. Just a question from Claudia on that one.
Oh, that's a good one. We've actually been talking about that now and then. What about Becca? Do you want to comment to that? There is a paper.
Oh, you go, Leslie, go on.
No, I was just going to say there's a potential for a big paper here.
We will be having an external evaluator to come and evaluate our program. So that's certainly one thing that's happening, to make sure that we do have all these outcomes, and we do have a highlight strategy. So at the end of that high level sort of timeline, we do have outcomes. We will be working with that evaluator about some specific sort of measures, like tools for this. It's still a bit of a work in progress, I'd say. Leslie, what would you say?
Mm-hmm. Yeah, we're very aware of it though, and it is something that is required, absolutely.
Yeah.
Also joined today by Sandy Reader, Monash Partners CCI Fellow. Sandy, over to you. Did you have any questions for Rebecca or Leslie?
Just first want to thank you for such a great presentation, but and you've given some amazing example of how you've engaged with consumers. So how do you know when you've got enough consumer engagement in a project?
It's a good question. You mean community? Do you mean involvement?
Indeed, yes.
I've got to get my head around that too, Sandy. It's a really good question. It's kind of like how long's a piece of string, isn't it? And one of the things that I did say earlier was that you're never, ever going to be able to represent absolutely everyone, that's for sure. But if we can look across our representation in our steering committees and really make sure we've got some terrific experience, not only lived, but terrific diversity, cold representation, Indigenous representation, and people who have worked passionately at high levels for change. That is kind of like a blueprint to hand over to our centres to say, hey, this is where we need to be. And I don't think you can ever have enough representation, because if you go from the committee setting the example and then supporting the centres to have that really good, robust, diverse representation, and then you link in with, and those committees link in with the community, and that community then forms the CCI Alliance. Then you've got the most amazing, huge group of voices, and that can be like a bottomless pit, I guess, Sandy. We can only hope. I'm not sure. Do you think that there's an idea that we could be saturated?
Well, that's opening a whole other can of worms.
Yeah. I can't give you a definitive on that, but all I can see is the vision of where we're going, to hopefully realize a huge connection across consumer and communities that is linked into this research network. That's the goal.
Absolutely. We're nearly coming up to 2 o'clock, and so I just wanted to take a moment, Leslie and Rebecca, to thank you for joining us today and for sharing your experience. I think the feedback in the chat has indicated that people have found it enormously useful to hear about some of the tools that you've used, and also, most importantly, how you've gone about it and what you've learned along the way. I'd like to thank everybody who joined us. To remind you, we'll circulate a recording of today's presentation and a brief summary of the key points as well. We don't have a seminar in April, but we do have one in May, and we hope to see you at that seminar. Until then, thank you to everybody. Thank you, Sandy and Victoria and Laura from the Monash Partners team. And we look forward to seeing you all in a few weeks' time. Thanks, everyone. Stay safe and well.
Thank you.
Thanks everyone.